Hi, I'm Lora Tesh from Soulmate Ragdolls, and I want to share with you today a few tips for what to do before and after a litter of babies are born. I recommend that you isolate your female in just a calm, quiet area about a week before she's going to have her babies. The gestational period is 65 days. Sometimes it can run a couple days over, or it can be a couple days early. You never know for sure, but just have her about a week in advance in an area where you can have her just be quiet and just start her nesting process. I'll show you in a second what I recommend for that. I want to tell you that there are a few things that you'll need, and if you can get them ready in advance and just have them nearby, that's a great idea. What I recommend getting, let me show you, is you're going to lay aside a few towels, a few washcloths, and those are to use during the delivery process. It will be messy, and she is going to get the towels messy, and so you'll want to change them out every now and then so that you can keep the baby nest nice and dry. Then here's my tray. It's a mobile tray. It's sort of a little working area. I have a roll of paper towels, a couple cotton balls. I recommend getting a couple pairs of gloves to have for sanitary reasons and to cut down on bacteria and so forth when you're handling the babies when they're first born. I also recommend you get unwaxed dental floss, not flavored, but just plain old dental floss. Then you're going to need a cutting apparatus. You're going to either need some good scissors that you can disinfect, stainless steel preferably, but if not, just get some that you only use for this process of birthing babies with the mother, and don't use them to cut other things. Just designate one pair that is going to be just for this and leave it at that. Okay, and you do want to disinfect them. You can use something to disinfect like povidone iodine prep pads. Now you can find these at Walmart or most drugstores. You can also find little pads like this that have alcohol on them instead of the instead of the povidone iodine pads. So either one, but you do want to disinfect them very good and then let them completely dry. Now what I like to use, I like to get these surgical blades. It's like what goes on the end of a scalpel. You have to be very, very, very careful because they're so sharp. I like to get these from my vet. And you can use these to cut the umbilical cord, or like I said before, you can use the scissors. Whatever works best for you. These I like because they're automatically sterilized. They come in individual packs, and once you use one, you just, once you're finished, you throw it away, and you're done, and you have a new one every time. If your vet won't give you that, then, you will resort to something like scissors, and that's okay, too. The last thing that I recommend you having is this first aid antiseptic. Well, it's actually povidone iodine, povidone-iodine. It's 10%. And this is actually the Walmart brand. It's called Equate. You can just buy a little bottle of iodine, and that's actually my first choice, but I have this, I was going to give this a try, so it works as well. But be very careful, a little FYI for you. Iodine is highly staining. So if you get it on your floor, you're going to get a stain on your floor, and you cannot get it out. Or if you can, I want you to let me know and tell me your secret, because I surely couldn't when it happened to me. You want to have this little tray available for whenever the big day is. And then, as I said, you're going to isolate their female. And here's what I do. A good nesting practice makes the females feel very comfortable. It's like putting a towel up, or like a little drape that they can hide behind. It makes them feel very comfortable. And then, as you can see here, this is Ruby. She's due to have babies any moment. You can have like a little baby nest with towels in it. And then I just slide it under here. I'm lucky enough to have a vanity in my bathroom that has a like a drawer above it, so I can tuck this towel in. Let me see what you're seeing. Yeah, I can tuck this towel in and then shut the drawer, and it's just like a nice little hideaway area for Ruby. See that? So That's what I recommend if you're lucky enough to have that. Now, the other thing that I do regarding Ruby, when we are going to have our babies, a little bit before that, I get a towel and I put across her, and then some paper towels here. This is sort of the aftermath that I'm showing you now. I recommend that you take some scissors, and please, folks, be very, very careful. Take your time. Don't get in a rush in doing this, because the cat's skin is very, very delicate, and you do not want to clip the skin. So just be really, really careful when you're doing this. What you're going to do is you take some scissors and you hold them sideways, and you just go around the nipples, and you're going to trim the hair just a little bit to make it so that it's not like such a big bush of hair for the babies to try and navigate through to find their where they need to nurse. And I just cut a little bit around each nipple. So I guess it's maybe like maybe 1/3 of an inch tall left there. But that way they're not scratching up her skin, but they do have easy access to the nipples. And as I clip it, I just put it over here on this paper towel. And then when you're finished, all you have to do is just grab up the paper towel and throw it away. And that's very simple to do. Those are the things that I recommend you doing. A little prep work after the babies have arrived and after delivery is over. I recommend that you take your female to the vet. You'll have to take your babies too, I believe, but bundle them up good. Put a towel over them. Put a heating pad in there. Whatever you need to do if it's cold in your area. You need to take the female to the vet and have them give a shot of oxytocin. Now, oxytocin is what's used in humans to induce labor with women that are not going into labor automatically. It's the same thing for cats, but it's used a little differently. If they're having difficulty with labor, sometimes vets will give it to, progress the labor. But if it goes successfully and everything's fine, you still want to give 1 cc, an injection of oxytocin, after the babies are born. And all vets should have this. So if you just take them and tell them that you want to follow up and get what she needs, I'm sure they're going to recommend this. I'm going to show you the spelling of the word. It's oxytocin, Oxytocin. Oxytocin. And every vet will have it, as I said. And what this is going to do for you, you need to give it, you need to give it within 24 hours. So you do need to take your kitty within 24 hours and have your vet give this injection. It will aid in the letdown of milk, and it will also cause her uterus to continue contracting a little bit, so that excess blood and fluids that remain behind after the babies have been born, that it will be cleaned out, and it's a good thing. I do recommend it. In a perfect world, we would all do this as a procedure, a safety precaution for our cats or dogs, I guess. The second thing that I do, I have my vet give a long-lasting antibiotic. Now, he or she can just give you an oral antibiotic to give your cat for a week, and that's just as a precaution to ward off any would-be infection that could occur. Even people have babies sometimes, and they develop an infection afterwards. It's just a common thing. It's just a safety precaution, preventive maintenance. And what my vet does, they just give a long-lasting injection of penicillin. I think it lasts for maybe up to a week. I'm not sure about the duration, but he calls it a long-lasting injection. And here is the name of that. It's penicillin G. Now, this is what my vet uses in particular. And penicillin G procaine is kind of a 2-in-1 type of mixture. But you can't